What's up? It's your favorite NPHP and welcome back to my channel. As you can see by the title, this is just a story time about my experience with my son in the ER recently. It started about 2 weeks ago. I might have the timing wrong, but it was recently. So about 2 weeks ago, I got a call. It was a Friday. I got a call from school saying my son is having fevers, chills. I had to come pick him up. So I went to go pick him up. Just from him walking from the school building to my car, he was very short of breath, dyspneic. And I was like, okay, we headed straight to urgent care because I'm like, it's either flu or COVID. So let's, find out what it is so we could, have the proper treatment and whatnot. So we went to urgent care. His COVID was negative, his flu was negative, and strep was negative. So, they tell you it's probably just a bad upper respiratory infection. It's going to get worse before it gets better. Just monitor his fevers, alternating Motrin and Tylenol, which is what I did. Brought him back home, was closely monitoring. We were alternating again the Motrin and the Tylenol. Thing is, his fever lasted at least 5 days. So Friday, Saturday, Sunday, Monday, Tuesday, right? So Tuesday, he finally broke fevers. He was getting his energy back. We're trying to now get his appetite back. But then I noticed him just walking pretty dyspneic on exertion. So I'm like, let's go to the ER. You should be normal now. If this was an upper respiratory infection and the fever's broke, you should be getting better. And it's like, you're pretty short of breath. So, and we also were taking his albuterol inhaler. When my son gets sick, when he gets an upper respiratory infection, he does get sicker than normal. So in the past, he was prescribed an albuterol inhaler when he was younger because he'll have these coughing fits and he was wheezy. He was never diagnosed with asthma. They will say he has asthma-like symptoms when he has a cold. My son has a cold maybe 3 times a year, so we don't use the albuterol inhaler. If you watch my vlogs, my son is a football player. He's a big man, and we do not need his albuterol inhaler. So I just want you to remember that. So he was never diagnosed with asthma. So where was I? So the fever stopped, but then he was still short of breath. So I was like, okay, first thing in the morning when I get off work, let's go straight to the ER. So that's what we did. Went straight to the ER, got to the ER around 8 o'clock. It wasn't busy at all. We was able to get right in. So to start in the beginning, when you first go to check in, they ask you, what brings you here? And I say, my son is very short of breath, very dyspneic on exertion. And the lady gave me a facial expression like, huh? And I was like, what happened to you? And I thought, do you need more information? He's been having a persistent cough, his fever, he's been having fevers, but the fever stopped on Tuesday. But now I just noticed he's still pretty short of breath and dyspneic on exertion. So she's like, okay, here's your wristband, just go to the side, triage will call you. And now in the triage room, this is where they're gonna check your blood pressure, your vital signs and whatnot, and get more information about your presenting illness, your chief complaint. So the nurse in the triage room, she's like, so you came here because of a cough? And I'm just like, oh no, well, I told her it was short of breath. My son's very dyspneic on exertion. I said he'd been having and dealing with a cough and he's been having fevers. My concern is he's very short of breath now. So we're in the triage room, the PCA. She was nervous. She kept on looking at the monitor because my son was desatting. So I wheeled him in the hospital with the wheelchair, so he didn't have to do any, much walking, but from the wheelchair to the triage room to the chair, the chair in the triage room, which is no more than 3 steps, he was very short of breath. He was desatting. And no, I did not check his pulse ox at home. Like I said, I felt he was getting better. And, as a mother, I didn't want to freak myself out nor freak him out. I was positive thoughts he's getting better, but just looking at him, I said, okay, there's something wrong. There's still something wrong. He's not getting better. So the morning that I did take him, I did finally listen to his lungs. I don't bring my stethoscope home. I leave it at work. But that morning, since I knew I was taking him to the ER, I was like, let's just listen to his lungs. I brought it home, or it was in my car. So I listened to his lung. He was pretty diminished, and especially on that right lower lobe. So anyway, in triage, he was desatting. He did a little walk of life. So on the room air, my son was only getting up to 92%, and when he ambulated, he was dropping to 88. Okay, so in my mind, the reason why I took him to the ED was, of course, because of his shortness of breath and his dyspneic on exertion, and he's just not getting better. Fever-wise, yes, fever stopped, but he's still not getting better. So it's like, okay, since it wasn't COVID, it wasn't flu, now I'm thinking, okay, this has to be pneumonia. People are saying there's walking pneumonia going around. This might be it. We ended up going back, and they didn't have a room ready for us yet, but they put us in another room that he could be on the telemonitor, because the nurse said herself, I want to keep a closer eye on him because of his oxygen levels. He's dropping, he's dipping down to 88. Okay. And again, I'm coming to the hospital thinking like, I need a chest x-ray, I need antibiotics, and plus or minus steroids, right? We finally get a room, the medical student comes in, he's a 4th-year medical student, so I give him the whole HPI, the history of present illness, what led up to today, and broke down everything. So before the med student walked out, I guess he realized, and he put 2 and 2 together, like, she has to work in the healthcare field, right? Because I don't go in saying I'm a nurse practitioner. I never do. If they ask, I will tell them. He was like, so basically, what did you want done? I said he needs a chest x-ray, and then pending that chest x-ray, he's going to need plus or minus some antibiotics and some steroids. I would love labs drawn, because just to see if he has a white count. Automatically, he's like, okay, I'm sure we're not going to draw labs. Yeah, I do agree with the chest x-ray, but I have to talk to my attending. And I'm like, oh yeah, I know how in teaching hospitals, I know attending has the last say of the workup, which is fine, which I'm thinking like, I'm sure that attending is gonna want a chest x-ray. The resident comes in. So remember, the first person was a med student, a 4th-year med student, or I guess, I don't know, for intern, whatever you call them. Second was the resident. So the resident comes in and he looks just like me. He has black scrubs, black jacket on, and the same black logo jacket on. So he was like, oh, are you in the medical field? And I told him, yes, I'm a nurse practitioner. He's like, okay, cool. So he's explaining back to me, what's been going on, and I'm filling in, the little holes, and I'm like, yep, that's what's going on. And so he's like, well, I don't think he needs a chest x-ray. And I'm just like, oh. He's like, I don't think he needs a chest x-ray. I just want to, just to limit radiation. And I'm like, oh, okay. But again, he's a resident. I know the attending still has to come in. So I'm just like, okay, that's what you're saying. He's like, I want to hold off because the radiation. You're saying that, he uses an inhaler. This could just be like asthma-like. And I'm like, well, yeah, no, he was never diagnosed with asthma. No testing done. He has quote unquote asthma-like symptoms. You might hear some wheezing. You might hear just like a persistent cough when he does have a cold. But yeah, we've been taking albuterol. Just nothing seems to work. He did his exam and whatnot. They leave and bring in the doctor. Doctor, she's cool, wonderful. Thing is, like, she took that asthma-like symptom and ran with it. She's like, I think this is asthma. And I was like, oh, okay. But in my mind, I'm like, okay, you guys are talking, but I still want a chest x-ray. I think this is asthma. Let's give him some albuterol treatment, see if he does good. If he does good, then, we know it's asthma, and like she was giving me examples. She was like, just think, a typical person who has the common cold do not need an inhaler. And I'm just like, true. So we could say that your son does have asthma. This is just probably mild asthma, but he has asthma. I think all he needs is Duonabs and some steroids, and he'll get better. My son still is looking the same, and he's kind of getting worse. He's sleeping, and his respirators are like 35, 40. He actually had the nose flaring, and I'm just thinking, asthma, and we just gave him all these albuterol. When the doctor was in the room, she's like, you know what? Let's just go ahead and get a chest x-ray. I was happy she was getting it, but I'm like, wouldn't that be the first thing? Wouldn't that have been prioritized when you seen my son desatting in triage? As you see, he's tachypneic at rest. He has the nose flaring. You're explaining all this, but I guess, again, she was stuck on the asthma. She even was giving me examples of her family. This is now 9 Duonabs later. Man, luckily I have a medical background, because a person who has low health literacy would have put their 100% faith in these doctors and gave the treatments, and maybe their son may have gotten better and they were going to be discharged. But my son did not get better. She did put the chest x-ray in. Chest x-ray results back. The resident comes back in a whole different demeanor. Even the hands was just like, so your son has multifocal pneumonia. And he has right lower lobe pleural effusion. And I'm just thinking, like, we were not going to get a chest x-ray because we wanted to limit radiation. You guys know I'm a nurse practitioner, and I work in a hospital. I don't work in the ED, but I admit from the ED. I see these things. And anyone who's coming in with some type of shortness of breath, desaturation, the first thing we want to do is check a chest x-ray to rule out any infection, any infectious cause that is causing this, or any type of pneumothorax. Kids have spontaneous pneumothorax. My son's in football. So I'm just thinking, why weren't they all about checking a chest x-ray? Like, if I worked in ED, I would have pushed for this chest x-ray and triage. Let's make sure there's no infection, because we could treat asthma like we did, versus checking a chest x-ray, finding out right away that it is pneumonia, getting antibiotics on board, and seeing if he improves that way. But anyway, I did eventually get my chest x-ray. Because why not? Let's just get a chest x-ray. And I'm just like, this is scary. This is very scary for the individuals that put 100% trust in these doctors. And I mean, yes, I want you guys to be comfortable enough to put 100% trust in these doctors and these providers, but look at my example. It's like, I have the background, and yes, I pushed for it. Well, I didn't have to push too much, because she gave in and said, why not? Let's just grab it. Man, it's just scary. It's scary because there's a lot of individuals out there, and especially when it comes to just our culture, our African American culture, the low economic class, and just low health literacy in general. You're at risk for your child getting severely sick. Like, if I didn't push and they were going to discharge my son, the next step would have been calling 911 ambulance to my house because he needs intubated. You know what I mean? But man, I was just thinking in there, and I actually cried. Like, mind you, I was tired, but I was very emotional because now I see my son going downhill. But I shed tears, and like, this is what you guys do? I'm coming, and you guys know I'm a nurse practitioner, and I'm telling you guys what I need. I told you when I first got in there, I need a chest x-ray, and likely some antibiotics and some steroids. Granted, I'm going based on, okay, if the chest x-ray shows some type of pneumonia, we need to get the antibiotics on board ASAP. Steroids, if he's hypoxic, I mean, we didn't really hear it wheezing, but steroids is a plus or minus. It may help, may not. He did get 1 dose of steroids in the ED. Not sure how much that contributed, but yeah, my point is like, being advocates for your loved ones, push for it. Yes, it's easier for myself to push for it because I know what's needed. I know what he needed. I know like what workup is needed to identify what is going on. So I was able to at least push. But I've seen is people sent me viral videos about families who are getting the runaround and not getting the chest x-ray and finding that they do have pneumonia. So my son was diagnosed with the walking pneumonia. They did a swab and it did come back positive for mycoplasma. He was on antibiotics. We stopped the albuterol treatments, nebulizers, stopped the steroids. So my son did go downhill in the ED. I think if that did not happen, and if the doctor did not want to get the chest x-ray, that would have pushed them to get a chest x-ray, knowing that he wasn't getting better with the albuterol treatments. But I spent 7 hours in the ED. My son needed a continuous BiPAP. So yeah, he needed a continuous BiPAP, and he was transferred to the ICU, and he was on a BiPAP for basically 2 days. Continuous BiPAP for 2 days, because basically that's how bad he got. Just sitting in the ED, even when the doctor came in, she's like, he's getting worse. And I'm like, he is. I mean, I was beating myself up because I was like, maybe I should have brought him in sooner. But I'm like, if I would have brought him in sooner and he even appeared stable, I don't think they would have even gotten a chest x-ray. I would have still fought for it, but it would have been a harder fight, Everything happens for a reason. The timing of when I brought my son in was perfect timing for the situation that I experienced. The point of this video is just that we as healthcare providers listen to your patient and, meet them halfway. I'm not a pediatrician. I'm not a pediatric NP, but just the basic workup, I feel like shortness of breath, dystonic exertion, desatting, x-ray is the first thing. But anyway, it's been a long week. My son is finally back at school. Today it was actually his second day back at school, and he's been doing okay. But know that walking pneumonia is going around right now. It's going around, and it's affecting our younger children, and some of them who are at baseline may need an albuterol inhaler when they have a cold, or if they do have the asthma history, sometimes they need extra oxygen support, like the BiPAP my son was on. Some people are walking around with it and they're fine. But know that if they do have the fevers, the persistent cough, the shortness of breath, the nausea, vomiting, the fatigue, it looks like the flu. Make sure you check the COVID and the flu. If those are negative and the symptoms persist, it likely is this pneumonia that's going around, and you do have to push for a chest x-ray, because that will be the only, well, you could get a swab for the mycoplasma bug itself, and if that comes out positive, okay, yeah, you could say, but it's like, as a provider, how can you call it pneumonia without seeing it on imaging? You know what I mean? I was never taught that way. I would like to confirm, even if I got the mycoplasma first, I would like to confirm to see how bad. Is it just the lower lobe or upper lobe? My son was multifocal, bilateral lobes, and he had a right small pleural effusion. There was more going on than just a pneumonia. You know what I mean? So this is what a chest x-ray tells you. You need to visually see what we're dealing with, what we're working with. You know what I mean? I just want to push for just being advocates for your family, your loved ones. Excuse me. I told my friends, like, if they ever get pushed back, call me. My close friends, they know to call me. Put me on the phone with the doctor. Put me on the phone with the provider. I actually had to do the same for my brother. My brother lives in Minnesota. He got very, very sick with pneumonia as well in June or early July. And again, he's in Minnesota, a whole different state than I am. And I was on the phone getting my brother transferred to a higher tertiary, inner city hospital. Like, I did it from miles away, but I got it done just so he could get the adequate care that he needed, because I felt that he wasn't receiving that care at that smaller hospital. They didn't deal with what he presented with. I feel like there's a lot more going on. As nurse practitioners, we're that perfect medium that could be amazing advocates for our patients, and I continue to encourage you guys to do so. It might be sometimes hard when you feel like you're going against your doctor, but as long as if they're able to explain it to you, the reasoning why they're not doing the testing, and you 100% understand, okay, but you have to feel comfortable because we're collaborating with doctors. So feel comfortable with the treatment that you and your doctors agree on. If you don't agree, please speak up for the sake of our patients, for the individuals that have low health literacy. We have to be their voice. I will end this video with an amazing Bible verse. This video got me riled up a little bit, but my son's doing a lot better. I just want to make sure everyone just gets heard. Everyone gets heard. So the Bible verse for today is Joshua 1 verse 9, and it says, I hereby command you, be strong and courageous. Do not be frightened or dismayed, for the Lord your God is with you wherever you go. This is just a perfect Bible verse that goes along with my story. I felt that I could have brought my son in sooner, but he was stable. And the fact that they had to see my son decline to get the proper treatment, when I tell you, I knew the Lord was with me. If you knew me back in the day, I was an anxious person. My mind would have been all over the place. Mind you, I was up for almost 24 hours by my son's side, and getting off work, caring for others, then dealing with my son. It was a lot, but when I tell you, I knew the Lord was with me, and I knew everything happened for a reason. Then the timing of everything happens for a reason. It was the right timing that I brought my son in at that time, that morning, so they could see the decline and get the chest x-ray. But yeah, just know that the Lord is always with you. He's always with you, even through the struggles, the obstacles. Have the faith and believe that he's always with you, and I know he's always with me. Appreciate him so much. I know he's looking down at me and congratulating me, because when I tell you, I probably, back in the day, several years ago, I probably would have been just crying and just nervous. Although I did have a wonderful friends on speed dial and kept checking in. I just want to give a shout out to Kendra, to Raina, to Lisa, to Rupa, to Jules, all my homegirls, and all my nurses and nurse practitioners and doctor friends who just, kept me in good spirits. I just thank the Lord for the amazing friends, amazing group of people that he allowed me to be a part of. I appreciate that, but just know that the Lord is always with you. I wish all you guys could have me on speed dial if you guys ever encounter a situation like this, because I'm here to help. And just be aware, if COVID is negative, flu is negative, symptoms persist, next it will be a chest x-ray. It will be a chest x-ray. Don't let them tell you differently. And if the chest x-ray comes back clear, okay, it's reassuring. We can all go to sleep peacefully. But obviously, if it shows something, then there's a different course of treatment that is needed. So yeah, until next time, see you later.